No, this is not junk food damage. This is happening because of a common nighttime habit most parents ignore. On the contrary, they consider it healthy. Recently, a 4-year-old child came to the clinic. His parents were worried because his front teeth were all turning black. They said, "Doctor, we don't give chocolates or sweets, only milk." So, milk was a problem. Most parents think that milk is harmless. On the contrary, they believe that it is healthy if consumed at night before going to bed. So this is one of the most common, most ignored reasons for severe tooth decay in toddlers. This has a name. It is called nursing bottle caries. It happens when the parent puts a child to bed with a bottle full of milk in his mouth. So the milk pools around the tooth and bacteria in the child's mouth feed on the sugars in milk, releasing acids. These acids melt away the tooth gradually, little by little. This happens every night. Imagine if this were happening for a matter of months every night. This is why most parents notice brown lesions or spots on the teeth of children. Sometimes they also notice black teeth, especially in the front area, as well as broken teeth. So by the time the parents can realize what is happening and can detect any decay, the damage is so severe that sometimes it is not reversible. If untreated, it can lead to severe pain in the child, difficulty in chewing, infections, and early tooth loss. Sometimes it might be necessary to remove the tooth at a very young age. This can be very traumatic for both the child as well as the parent. So, what is the most common mistake parents often make? Primary mistake number 1: putting your child to bed with a bottle of milk is the most dangerous reason for nursing bottle caries. The reason number 2 is not cleaning the child's teeth after feeding. The third reason is adding sugar or flavored milk in the feeding bottle. And the fourth reason is thinking that milk teeth are not important and do not matter. They do matter. Now, coming to a very important topic about decay in children. Decay in children is considered as the most common chronic disease in children worldwide. It occurs 5 times more than asthma and 7 times more than hay fever. More than 50% of children in the age group of 0 to 6 years have dental decay in some form or the other. So, let us find out what is the main reason why decay in children occurs so commonly and spreads rapidly. The protective coating of the teeth, called enamel in children, is very thin, weak, soft and porous compared to the enamel of adult teeth. In addition, the dentin of child teeth is not as dense like in adults. Besides, the pulp, which is the nerve and blood center of the tooth, is very large and very close to the dentin in children compared to adult teeth. So once decay sets in, it spreads real rapidly, just like wildfire in a forest, and reaches a pulp resulting in severe pain and infections. In this state, it is irreversible and normal fillings will not help. So now let's see how to avoid and prevent decay in children. So the first thing is, as soon as the baby teeth come out, it is time to start brushing the teeth. Brushing a child's teeth should be done under the supervision of an adult until the child is around 7 years of age. Brushing should be done twice daily with an ultra soft bristled toothbrush or fingers for 2 minutes each time. It is very important to use a fluoride toothpaste. A smear is sufficient for kids below 3 years, while a pea-sized quantity is required for children in the age group of 3 to 6. Another way to prevent decay in toddlers is, do not put them to bed with a feeding bottle or a sipping cup containing milk or any other sugary fluid. In case the child is addicted to sleeping with the feeding bottle, replace the sugary liquid, which could be milk or any fruit juice, with water. It is very important to clean the child's teeth after feeding. Again, it is important to visit the dentist after the milk teeth first comes within 6 months. Avoid giving the child sticky and sugary food in between meals, and ask them to drink plenty of water and rinse their mouth with water each time they have a meal. So if you are the parent of a child, this is something which you should know. If you know a parent of a child, please share this video because it is treatable. So a single habit can actually save the smile of a child tomorrow. Hope this is helpful. Please like, share and subscribe.